Good afternoon. I'm Monica Hendrickson, the Public Health Administrator for the Peoria City County Health Department, and welcome to our weekly COVID update. For the Tri-County region of Peoria, Tazewell, and Woodford County, we now sit at 39,109 cases to date. That's 39,109. That's an increase of 1,611 cases over the past week alone. That brings Peoria County with an additional 944 cases this past week to 19,817. Tazewell County with an additional 522 cases to 15,055. And Woodford County with an additional 145 cases this week to 4,237. We had 5 additional deaths to report over the past week, bringing the Tri-County total to 602. While a majority of our cases are considered recovered, we did see an increase of those at home and isolating, and that's largely due to increases in the number of cases, as well as over the past week, we saw an increase in the number of hospitalizations. We now sit at 0.18% of our cases hospitalized, which is an increase of 0.07% from last week. Our Tri-County daily 7-day average is now at 230 cases compared to 195 just 1 week ago. Likewise, our hospitals are also seeing the impacts of this increased numbers of cases. That includes our ICU usage to date for today at 38, including 89 med-surg beds, and sad to report 1 death in the past 24 hours at our hospitals. The now 7-day ICU average is at 29 beds in use compared to 11, which was last week, and our med-surg now sits at 74 compared to 41. What we are actually seeing is a lot of things coming together at once. First and foremost, the majority of our cases are sitting in a younger age population, that being the 0 to 19-year-old population. And in fact, 40% of our current active cases are under the age of 30, while just over 2,800 Peoria County residents under the age of 30 are considered fully vaccinated. Many of these cases we saw through our contact tracing were related to activities outside of the daily school setting, which includes sports teams, dance academies, group dinners, as well as travel and family get-togethers. We're now starting to see the impacts of Easter as well. The biggest thing to understand is not everyone is vaccinated yet, and in fact, not everyone can be vaccinated. This is a different type of COVID fatigue. You know, we've talked about COVID fatigue in the past, but I think what adds another layer to this is the fact that we all see now what vaccination looks like. There's this silver lining, this hope that we have, but again, this is not a time to let our guard down, and our numbers are showing that. People, I think, are getting a little complacent. They think there's a solution, and again, not everyone is vaccinated. Additionally, a lot of our data shows that our positivity has jumped. Now, positivity is a number divided by another number. You know, our numerator divided by our denominator. And while the total number of tests has decreased compared to where we sat in the fall, let's not forget that the numerator, or that N, is still large. We're still sitting at adding 1,600 cases in 1 week in our Tri-County. That's something we cannot ignore. And then lastly, we also see that we have variants in our community. Currently, we're investigating 21 different variants cases in our community, primarily the P1 as well as the B117 variants. All of these are challenges, but at the same time, there is still the need to not only continue masking, socially distancing, and staying home with you when you're sick, but also getting vaccinated. And we're very excited by the fact that this past week we were able to open it up for all 16 and 17-year-olds to also get vaccinated. The entire community is now fully able to, those that are eligible to get the vaccine. And it's really important to do that, especially in our younger population where we're seeing so many of the cases. To talk more about this, we have Dr. McRae, Internal Medicine and Pediatrics at OSF.
Good afternoon. My name is Randy McCrae. We see all ages in our practice, and I think while it's been very important to approach COVID the way we have, where we targeted the oldest and most frail and most likely to be injured by COVID earliest, but we're at a time now where a majority of that group in our area fortunately have been able to receive vaccine. As Monica said, the lion's share of the new cases that we're seeing currently in this spike have been in the younger age groups. And there's a variety of reasons that she quoted. One of those is, though, that either previous lack of access to getting the vaccine, or in some instances fear and choice to not get the vaccine. The latest availability for 16 and 17-year-olds I think is very, very important. In PEDS we say kids are not just little adults, but 16 and 17-year-olds pretty much are adults. And so the large numbers of people that have received the vaccine and done well with it and have shown in follow-up studies to have a good response to the vaccine is something that we fully expect in the 16 and 17-year-olds as well. The Pfizer Corporation has done larger scale testing on that group, as well as the 12 to 15-year-olds. And they've seen just as positive of a response to the vaccine and similar, less or lesser potential side effects. I know a lot of persons are concerned about side effects themselves, and maybe parents are concerned about side effects for the young adults that they're responsible for. I think the side effects we've all heard about, perhaps feeling tired, fatigued, headache, low-grade fever, stomach distress, are in a very small amount of this age group. They do tolerate it well, and it's not expected to limit the capability of giving that in mass and as much as we can. Currently, Pfizer is the only approved vaccination provider in this group. For those that don't know, Pfizer is a first vaccine followed by a second vaccine approximately 3 weeks later. At 2 weeks after the second vaccine, they are felt to be fully as effective as that vaccine can be to prevent illness. Pfizer's recently released, as I said, some data on 12 to 15-year-olds as well, and it looks like it's very effective in that group as well. And Unity Point both have a website that their patients have access to. They've been sent messages in the past that they are available for those vaccines and will continue to have that. On those sites, there's also a place that there's a printable copy of a parental permission slip for that child to get that vaccine. So the parent does not actually have to be on site when the child, the 16 and 17-year-olds, would go for their vaccine. If they can get that all performed first, that person can bring that with them. As you've heard, the availability is much more widespread than it was at many of our local pharmacies, as well as the IDPH Center. I'm sure Monica will provide numbers and websites along with this that they can access as well to obtain that vaccine. I think it's very important for us as a community to think about these group of people in particular. 16 and 17-year-olds are coming into the last years of their high school career. They deserve that option to experience that fully. Participation in extracurricular activities in school itself without interruption of their education. really fun things like homecomings and dances. Many students will choose to want to go to college, and to have that opportunity to go for college visits. It may be important for them to have been vaccinated. Students that want to try to travel abroad for different reasons are all going to need this as much as they can to make their lives as close to normal. So we're hoping that as the Peoria Tri-County area has done in the elderly, 65 and above, where there's been a vigorous response and a good showing for getting vaccinated, we hope additionally adding the 16 and 17-year-old group, they will respond to this very positively and get out and get vaccinated to get us back to close to as normal. Thank you.
Any questions for
Dr. McCray?
Yes.
We got some word that parents were worried about reproductive health for their younger children later in life. Have people asked you about that? What's possible the impact on that with this vaccine?
Yes, that topic was very widespread on social media and internet sites early on in this process. And it came forward a lot in healthcare professionals of young ages, many of which are nurses, that were concerned about this. And pretty much all of the expert committees and bodies on this, including the American College of Gynecology, have said there is no concern for fertility issues in particular.
What is the most common question or most common fear that patients of yours have when they say they don't want the vaccine?
I think it usually has come back to this was developed very quickly and didn't seem to have a long period of testing. And I think the answers to that have been shared before, but the type of vaccines that we've had allowed them to be manufactured at a pretty aggressive rate. And the size of the groups that they were tested on were much actually larger than typical vaccines that we test people before we say that they're acceptable. But I think that's the fear, is that it happened quickly, but I think now that we've vaccinated hundreds of millions of people, I think the public should be much more confident that we have not seen unexpected negative effects of any sort, and people have done well.
Lastly, if you give a rough ballpark of, let's say, how many of your patients, is it 1 in 5, 1 in 10, say, I'm not so sure about this vaccine?
Well, that's interesting. I think it's very age dependent. The elderly and adults that have elderly family members that are at high risk are uniformly accepting and seem to be in favor, and I would say it's less than 1 in 20 of that group that say they don't want the vaccine. I think the more widespread publicity that the youth don't seem to get as sick, don't seem to end up in hospitals and die, has been kind of a negative, because I think people take that as a, oh, well, then I don't have to worry about it. But we've seen plenty of young adults that have had very serious disease. We have a lot of kids locally and certainly nationally that have had complications that don't receive the same amount of publicity as the potential for negatives. So I think in the younger folks, it maybe is as high as 1 out of 5 are saying, I'm not sure I want to get this. So I think we as a community and a healthcare profession need to really promote this because of all the positives, and the only way to make this go away is if enough people are vaccinated to provide a little bit more reliable, long-lasting herd immunity so this stops spreading at the rates it does. The Pfizer vaccine is covering these variants that Monica mentioned, so even though there's variants showing up, they're covered just as well in that.
And on the topic of promotion, do you know what, if any, outreach attempts are being used to target the younger generation?
Well,
Population?
yes. I mean, I think for at least the healthcare organization I work for, there's individual offices are telling all their providers to share this with the families as they come through. The patient portals that are available to families that are involved in a healthcare organization are getting messages. They are getting specific invitations. They are getting some information as it becomes available to them. I know there's discussion on using other platforms like Facebook, like TikTok, all kinds of ways to try to reach out to particularly this younger generation because that's the way they communicate. We're joking. And not an increased rate over others that have already been doing it.
Thank you so much.
Thank you.
Yep.
You know, kind of also to highlight, just so you understand kind of what we're seeing as differences, and I think that's a great point about the younger population. Right now, from just one of our hospital systems reported out, just watching their own numbers, 20% of individuals that are currently hospitalized are under the age of 45, which again just shows you that we're seeing based on vaccination, the population that's getting the more severe illness, the more hospitalizations, are now trending to a younger population. And it's really important to make sure different individual groups, and we take, you know, a really strong approach to those groups to get vaccinated because of the work they do. To kind of speak more about that is Jimmy Dillon from West Central Buildings and Construction and Trades.
Thanks, Monica. And for those of you who don't know, the West Central Construction Building Trades Council is, I represent 17,000 union construction workers in 13 counties from here to the Mississippi River. So it's a little sombering and humble to be here after a year of this. A year ago, I was in my basement learning how to try to use Zoom, worried about toilet paper and everything else, and we're still talking about it. And we've come so far, but we're not there yet, and we got farther to go. And so that's why I want to stress to all the construction workers and people that are essential, now is the time to get the shot. And what people don't understand is the health department, through Monica's team, Jason Marks, and the whole team that they have here, they've been reaching out to industries months ago to get to this point. We've had communications with the hospitals. So everybody thinks this just came, but this has been months of preparation that they've gotten to get to this point, and now we're starting to see where we're eligible. We were considered 1C, which was in the central. 1C had a short window, and now everybody's essential. And I'm 42 years old, and in the last 2 weeks, I feel like I know more people than the last 6 months prior that have come down with this. Some my age, some slightly older, some younger, and it's wild how it affects everybody so different. So to the workers that can get it, I just want to make sure that we've seen our industry change quite a bit over the last year. We're in your houses, we're in power plants, we're in CAT, we're everywhere working. And for the safety of everybody, I want to encourage those essential workers to continue to do that. And on that note, if you do get the opportunity, the one thing that stuck with me for months is when Monica tells you, if you get that opportunity, it doesn't matter what shot it is, whether it be Pfizer, Moderna, or Johnson & Johnson. I fell in the camp, oh, I want that one shot. But it doesn't matter. The shot is the shot, and it works. But I got a call from Pfizer, and I took it because what was in the back of my head was Monica saying, if you get the call, take the shot. So I just want, from our industry, the construction industry in general, to thank the health department for all the communication that they've done. I've heard numerous comments from the multiple counties I'm in about how well Peoria region has done communicating, and then we're blessed to have the 2 hospital systems here. And thank you to all the healthcare workers that have gotten us this far, that are the ones that are giving us a shot. So that's pretty much in a nutshell from the construction industry. Is just wanting to encourage. I know you think you're young, strong, young, healthy, and can go, but it's not about you. It's about your parents. It's about your kids, and it's about everybody else. And it's about getting back to enjoying Cubs baseball and the things that we normally take for granted. So I just want to strongly encourage, if you get the opportunity, to take it. So you were way more interesting. You had all sorts of questions.
Before I open it up to some questions, I did want to give you, I know there was a lot of movement in the Tri-County in terms of vaccine clinics. So I wanted to kind of just go over an overview of what those mean. That was at Tazewell County, that will be at Tazewell County on Friday. They're expected to do 800 doses of Johnson & Johnson. There was a team out yesterday in Woodford County where they did 800 doses of Johnson & Johnson. Because of Peoria County's capacity with our partnership with AMT and our strike team, we were actually provided, rather than the actual guard coming up, we were given just the doses, which was 1,000 doses. And in Peoria County, we've set up a couple of different locations. So for example, we were at St. Paul's on Tuesday afternoon, and that was a walk-in clinic for Johnson & Johnson. This morning, we were at Carver Center. This afternoon, currently, we're actually at CityLink. And then next week, we'll be at Illini Bluffs and in Chillicothe. All of these are going to be Johnson & Johnson pop-up clinics. They are actually available off of our website, and you can also find them on Facebook when they go live. The Ward Chapel site that was on Tuesday was actually not part of the rapid response, but a different partnership through the Office of Minority Health and Illinois Department of Public Health, targeting historically Black churches throughout the state. And so we were very lucky that we had the option to have Ward Chapel be one of those sites, and they did 500 at that location as well. I think I want to say Board Member Dillon really also hit on the aspect of whatever vaccine you get, please get. We've heard all this week, a lot of people are excited that it's Johnson & Johnson. It's one, it's the convenience, they're done. But as many of you know in the news, there was an issue at the manufacturing site in Baltimore. And so we do not expect to have much more Johnson & Johnson coming. There's going to be a gap for what we expected early on because of that error. So if it's a Moderna, get the Moderna. If it's a Pfizer, get the Pfizer. And if we are lucky enough to get an appointment at a Johnson & Johnson clinic, get one. But the thing to take away, again, is whatever option you can have, please get it, and get it immediately. The only way that we're going to get ahead of this is if we get enough people vaccinated quickly. And again, continue following those great practices. This is allergy season. I know in my own household, I've had to go get tested a few times to make sure I knew what I was having. Get tested. The testing sites are still operational. Wear your face mask, practice social distancing, just make sure you're taking those steps, and then last, of course, get yourself vaccinated. So with that, I'll open up to some questions.
First question, Monica,
If
about
the surge mostly is younger people, then is it time to put a stop to, sports, other things, at least until we get more vaccinations of this population? So we just put it on pause so we can get more vaccinations?
So part of the problem too is with just making the assumption that we shut down some of these activities, whether it's a sport activity or a dance academy of some sort, is that some of that population is not eligible for vaccinations as well. So really, the things that we're talking about, the non-pharmaceutical interventions, those are still going to be key. What makes it really important, though, is that these children who sometimes tend to have a milder or even asymptomatic for COVID then share that with parents or siblings or older adults that are not vaccinated. So really the focus is still making sure we get as many people as vaccinated. Again, that's that herd immunity, so that even if a child has it and it's mild or even asymptomatic, and they're going to an adult, it's not transferring over. The adult has that vaccine and then not taking on to their office area or if they, to another family member, an elderly adult. So again, I think the practices that we have in place as interventions are really important. What I want to really focus on, and this is frustrating, I think I've shared this before, I am the mom of 2 small children. I understand the frustrations that come with trying to balance that personal growth, wanting them to have those activities, but also the safety of our community. It is a challenge, and seeing the vaccine happen and get through, I mean, people are getting excited. I know a lot of people told me around Easter they got to hug a grandparent for the first time. And, that's what we're really looking forward to. But we have to be really careful. Those activities, when people are vaccinated and you're able to do that safely, that's great. But having large get-togethers, especially, having like an entire sports team out at a bar or a restaurant for an event, or having a unofficial or unsanctioned prom. Those are activities that we really should not be promoting. And I think as parents and adults in our community, we really should be looking at that as an opportunity to say, you know what, we care about you as young adults, we care about our community, we really should not be promoting these activities.
So this current surge that's happening, is it mainly what you described, where younger people are getting milder cases, but then they're going home and they're taking it to their families who might be getting more severe cases then?
Exactly, and this is what we've always said, it's the fact that this transmits, and in the family unit, it can transmit really quickly. So again, getting vaccinated, especially the adults in our community, is really key. If you are 16 or older and you're medically able to do
You can keep youth in sports, or should we avoid it? Obviously, you want to avoid gatherings like going out to a restaurant with the whole entire team, but can we play it safely, you think?
I think we can play it safely. I think our schools have shown that they've done the best practices. And I'll say it's definitely, again, going to be the responsibility of the adults. Part of the difficulty we have as a local, and I'll be the first one to say this, is not the school-sanctioned activities. Our schools have done a great job because they're primarily wanting to make sure students are continuing their education, they're not missing anything. The issue comes is those activities are maybe not related to school settings. And I want to make sure that distinction is very clear. And so again, I don't want to say no and shut down sports, or let's talk about mitigation and our steps moving backwards. I think the first step is going to be asking the community to recognize that we have the virus, it is still spreading very quickly. And with these variants, they're going to be fast spreaders. I mean, that's what these variants are. So again, this is not a time for complacency at all.
You mentioned mitigations. In terms of ICU, you've given a number of how many beds we have right now in use in the Tri-County. I think it was 38, correct? Am I right?
Right now, today, we have 38 ICU beds in use, yes.
Okay. In terms of that, percentage-wise, is that near the 20% figure? Where does that line up versus where we are overall?
We're still above that 20%, but again, that is something we are very much monitoring, because when we dip below that, that's concerning not only for our hospital systems, and I'm saying this as very unbiased as I can, if our two hospital systems see a huge amount of surge in their ICU, that doesn't only impact Peoria, that impacts over a 30-county region, all of central Illinois, because our hospitals take care of such a large population size. And so again, we're really monitoring them, and they are monitoring it as well.
Do you know what 38 is percentage-wise of?
No, I don't have that number right now.
Okay.
So realistically, Region 2, we're not doing well right now in terms of our positivity, especially here in Peoria County, we're a national hotspot right now. I mean, how close are we? Are we potentially seeing mitigations come back, going back from Tier 4 to some earlier stage?
I think there's going to be a possibility for mitigations. What they look like might be different, because again, now we're sitting in a different landscape. We're sitting in a landscape where vaccine is available. And so we want to make sure that our mitigations prior were in a scenario where we did not have vaccine, or we did not have vaccine that was readily available. Those two things are now changing as we speak. And so I think if there are mitigations, it's going to look a lot different than what we saw in November.
So going off of that, we reached out to ID Education. They said basically what you did. Those tiers were for a time when there was no vaccine. So would it look different, you think, capacity-wise, and would it be different requirements? Like, obviously, we're really close to that 20% ICU capacity line. Would there be different requirements set maybe if this surge continues?
I wouldn't be surprised if there would be different requirements met when the surge continues. I think even the metrics we measure would look differently as well.
The fact that deaths have gone down as well and are staying down, that's going to affect mitigations as well?
I believe so, and I think that's just a great example of how the vaccines have been working. The first two tiers of the vaccination programs were targeting individuals at high risk for mortality and morbidity, and based on age and comorbidities. And so when we see our death rates staying low, that's a great sign. That shows you that vaccines really work. As Dr. McRae spoke, that was a group that we targeted, and we targeted really quickly and fast. And I think Peoria, we did a great job when we talked to our hospital systems and said, hey, the 65 and older population, they are used to getting their health care through their hospital systems. So let's make sure we push as much as we can out to them. Now we're going to use that same model for our 16 and 17-year-olds. They've been at a touch point with a hospital system for either school physicals or immunizations. So again, we're going to use that same model to try to push as much vaccine to that population. And hopefully, parents, you make those appointments, you click OK, and you get your kid vaccinated.
With the vaccines being out there, is it a situation now where, I mean, I spoke to Dr. Sater earlier today, and he said that the people who are coming in, who are in the hospital, for the most part, have not been vaccinated. And so is this a situation now where the tool is out there? If the people don't use it, we're not going to shut down society again. People need to use the tool.
I don't know if I would put it that way, because that would make it sound like the people that don't use the tool or the vaccine have no impact on the rest of us, right? And the case of the matter is they do. Every time the vaccine meets a different host, it has the option to mutate and change. And that's why, even if you think you're perfectly healthy and there's nothing issue with you, or that everyone around you that would be that high mortality or morbidity got vaccinated, so now you feel like you have a blank check. That's not the case. You still have the ability to create a variant that could change the landscape again. So that's why we really want to make sure everyone gets vaccinated. And it's not about you, it's about everyone.
You mentioned the Johnson & Johnson clinics that happened this week and a couple in Peoria County next week. Is that something we can plan on seeing in the future as more Johnson & Johnson shots are received? Obviously, you said there might be a delay, but...
We're hoping, and I think that's the other part of this conversation, is that early on, high demand, low volume, and now that demand and volume are pretty much keeping in pace, we know there's going to be another stage. Another stage will be not that demand doesn't exist, but it's going to be a convenience. I work these hours, you should come to my employment, or while I'm driving home, I see a pop-up site, I'm going to come in and just do a walk-in. So we know that there's going to be the next stage, which is more of how do you get the vaccine out to different corners of our county, different populations, just make it easier, taking away any type of barriers. And then sadly, there's that last stage where the demand is very low and the volume of vaccine is very, very high, but we still need people to continue to get vaccinated.
I did have one last question on the hospitalization data. You said a large chunk of them were the under 45. As far as, do you have any data on the 0 to 19 that we're seeing this big spike in right now? That's any hospitalizations there?
There is hospitalizations there, but I don't have the percentage with me. I only have the percentage for the 45 and under.
And what you said that was?
20.
20, okay.
20%.
When we get the Pfizer deployed to the 16, 17-year-old, given that we're only getting, I don't know how much are we getting per week and how quickly can we get it out?
So right now, I can say that the allocation that Peoria got for the past 2 weeks for Pfizer has been what's known as a tray, which is 1,170 doses. And what we've been able to do is make sure we are sharing that allocation between the two hospital systems.
Are there any plans to get vaccine in the hands of the universities? I talked to Bradley University today, and they say that's something they'd really like to do, but that the health department hasn't given them any vaccines so far. Now that we're getting more vaccine, is that something that can happen?
I think once we get more vaccine and we're pushing it out, we can definitely share it with our university systems. I think it's also important to understand that we don't actually have control of what type of vaccine we get. So I know a lot of our universities want a 1 dose because many of their students are leaving in a few weeks. And again, because of the Baltimore issue, which I think was 15 million doses that were lost for Johnson & Johnson, we're not getting any Johnson & Johnson. And so, we would be able to provide Moderna to our universities, not maybe into the volume that they would want to cover all their students at once. But again, with that, then the expectation is that in 28 days, they're giving a second dose to those students as well. And that might be a challenge for our universities right now.
And back to the issue of beds again, sorry to ask this again. 38 beds in use, that's across the tri-counties, right?
That's within the 2 hospital systems.
In the
Yep.
tri-county. Okay, 2 hospital systems. Now, you said we're near 20%. Is that in Region 2 or in the tri-county?
For the under 45?
Just like nearing ICU capacity, yeah, is that,
That is for the, I believe, for the tri-county area.
do you know, because now, if I'm not mistaken, in Region 2, it has to be by a region thing. So is Region 2 in a similar spot as the tri-county?
I would direct you to the IDPH regional metrics for that one. Any
Are
other?
we still seeing a lot of severe cases? You said 40% is like that younger population. Is the majority of the people being hospitalized still older? And I guess going back to Leslie's question, are most of those older people unvaccinated?
Yes, we're seeing older individuals still making, I would say, more of the severe cases, or those with comorbidities making the severe cases, and they are not vaccinated.
The mitigations will only happen on the regional level, not by the tri-county level?
The way the state has done the mitigations has always been through a regional approach, yep. Any other questions? I would just like to ask, again, we are trying to make sure that when we do get vaccines, sometimes we find out the day before, and we try to turn around and do a lot of these pop-up clinics. So as our media partners, if we do have this, I would just ask that you be able to share as quickly as possible on your avenues, because we find that a lot of people have quoted seeing it on one of our media stations as a way they found out that they can make these appointments. So again, this partnership has been really important, and as we get more vaccine, hopefully we can turn around and make these sites available, and we'd be reaching out to all of you to support that kind of information sharing. So thank you all. Have a good one.
Thank you.